I'd like to invite Dr. Chris Longhurst, and who is now the Chief Medical Officer of UC San Diego, and Dr. Mosen to kick off this California Notify program.
Thank you, Amy. And I was just reminiscing earlier about how many phone calls and Zoom calls we had to kick this off. So appreciate all the introductions, really excited for the symposium today. And in honor of Throwback Thursday, you can see my background is actually one of the original backgrounds from 12 months ago. So if we can go to the next slide, please, Kenny. We did start with a pilot, first at UC San Diego with the return of our students in late September, and then at UC San Francisco about a week later. And we expanded that about a year ago to 6 other UC campuses, including UC Berkeley. And so if you scan this code in the background, you'll see that this was the original UC Health website that helped to drive this initial University of California pilot. And based on this pilot data, we partnered with the state of California, Apple, Google, and the California Department of Technology and Public Health on expansion statewide. So on the next slide, you'll see about the original pilot was branded as CA Notify, although for a few minutes, it was actually California COVID Notify, as you see in my background. And we really focused on the trust, privacy, accessibility, and then rapid cycle iteration. This was the first rollout of the Exposure Notification Express product, which allowed integration on Apple phones right into the operating system, and was an app built by Google in the Google Play App Store for Android phones. We learned with data as well as engagement and focus groups led by some members and panelists today from our students, from our employees across UC. And we prepared for statewide launch that was authorized shortly after Thanksgiving, announced December 7th, and went live December 10th. So on the next slide, you can see that just as a reminder, Google Apple exposure notification is completely voluntary. It's completely anonymous, private, secure, with no location data, as had been reported in other countries prior to this rollout. It's very adaptable, and we thank our partners for the configuration that they've built in for our risk models. And it's trustworthy. It's really human-centered and accessible. On the next slide, just a quick review of how CA Notify works. First, you add it to your phone, and in the second spot there, when you're in close contact, your phones exchange these anonymous codes using Bluetooth signals, which is the perfect technology for this because it is not location centered, it's proximity centered. Now, if one of those users tests positive for COVID-19, then they can enter a code to notify anybody that they've been nearby in an anonymous way. And so number 4 there is the next step. You would receive an exposure notification had you been near somebody that actually tested positive. In fact, I had my first exposure notification just a couple of weeks ago, and it was from a known colleague I had dinner with, fortunately outside, but it was neat to see the technology work, and very rapidly as well. On step number 5, if you tested positive, then you would receive a text message from California Department of Public Health with a code that would allow you to anonymously alert others. And finally, there's step 6. You follow instructions from the website that we link you to about how to protect yourself and people around you by testing and staying away from others. Now, on my last slide here, I want to share the story of Alexis Rivas. And I think Alexis is going to be on the symposium today. She shared her story publicly, and you can read more about it by scanning this QR code. But Alexis received an exposure notification alert just a few weeks ago. She did not know that she had been exposed. She had no known friends or family members or contacts that alerted her that she might have been exposed. But because she got this alert, she went to UC San Diego Health here in San Diego. She received a PCR test, and that returned less than 12 hours later with a positive result. And so she actually shared her story as a member of the media, and you can read about it. But this is exactly the kind of story that we're hearing more and more of, particularly as the state has reopened, with an average of 6 other individuals alerted for every positive exposure notification that's triggered. This can be a valuable tool